Hello, everybody. Great to have you with us this evening. My name is John Wilkes. I have the privilege of being the Chief Executive of the Institute of Health and Social Care Management. That is a membership organisation for managers across health and social care. And we're delighted this evening to be welcoming Dr Tony Lloyd and Tina Elcock to an event, a PowerHour event that is all about neurodiversity. This is a topic that is well, perhaps it's misunderstood a little bit across the piece, but we're going to certainly illuminate what it's all about this evening. And hopefully Tony and Tina are going to be able to help us to explore the subject in a bit more detail. We are indebted this evening to an educational grant from SFI Health. They're making this all happen. We're very, very grateful to them. And we'll perhaps give them the opportunity at the end to ask a couple of questions of their own. But for now, Tony and Tina, fantastic to welcome you. I should explain that Tony is Chief Executive of the ADHD Foundation Neurodiversity charity and is a child and adolescent psychotherapist. And Tina Elcock is the ADHD clinical lead at Birmingham and Solihull Mental Health Trust. We're really blessed that you're with us this evening. Thank you. Let's start first with Tina, perhaps. Let's give Tina the opportunity to this. Tina, what should we understand by the term neurodiversity, and why is it important?
Neurodiversity is a very umbrella term for a number of neurodevelopmental conditions. Obviously, most of us probably see ADHD, autism, dyspraxia, dyslexia, all of these. But the umbrella is really vast, and it's about understanding that we're different, but very much the same as well. So my favourite analogy about being neurodiverse is being an Apple phone in an Android world. So you sort of get it, but you don't get it, and the same the other way. So people get me, but then don't get me. The reason I suppose that I went for being diagnosed with ADHD and autism is very much around the idea of that I've worked for the NHS for nearly 37 years. Changed massively in that length of time. When I did my nurse training, you didn't have to go to uni and all these sorts of stuff. It was very hands-on learning, and I have an ability just to gather information by osmosis. So the whole experience of what that is. So being on a ward, being in a clinic, but you either like me or you don't. But I wasn't ever sure what I did wrong. And I didn't quite see my limitations as far as other people were concerned, that I couldn't do the alphabet or that I didn't finish things. And well, I thought I had, So, and I suppose it's just from my perspective is that it's not about jumping on a bandwagon or anything like that. It's very much is that if you strive to have neurodevelopmental employees, then get the work around it sorted. So yes, it's okay having somebody that's
tolerance and an understanding, perhaps.
Yeah, most definitely, but also the really practical everyday things like
we will come
what's
on
the office like?
Promise. Yeah, we will come on to that. Like? I promise. I'm going to ask the same thing of Tony. I do love the Apple in an Android case. I think that's fantastic.
Yeah, that's my favourite.
Tony, do you have anything to add? I wonder.
Well, I mean, I think what Tina said is quite accurate, but I think from a broader perspective, because I know a lot of people who are on the webinar work in the health sector, and I think for many people they're going to be asking themselves, how does a neurodiversity paradigm fit within a medical model? And I think certainly around how language is evolving, and the fact that, I mean, we understand that 1 in 10 people have dyslexia, 1 in 20 have ADHD, 1 in 20 have dyspraxic, 1 in 20 we think are dyscalculic, 1 in 60 something are autistic. These are naturally occurring phenomena that have been around for as long as human beings have. And if you do the meta-analysis, that equates to about 1 in 5 people. So you have to ask yourself the question, are 1 in 5 human beings disordered? Just because they're on the outside of a standard distribution curve. In my view, neurodiversity means that there's an evolutionary purpose why people have different minds. And in the same way that there are no two human beings that look or sound the same out of 7.5 billion people on this planet, equally, everybody's neurology is as unique as their fingerprint. And when it comes to things like ADHD and autism, they're dimensional, to use the medical term disorders, they're dimensional rather than categorical. So context matters a great deal. And I think within our educational paradigm, because as with our medical paradigm, it's often quite deficit-based, impairment-based, rather than a more balanced sort of strength-based as well as sort of challenge-based. Then I think the disadvantage, the exclusion, the isolation, the compounding anxieties that contribute to a predisposition towards mental health problems like anxiety and depression, because we know that people with autism and ADHD are more vulnerable to things like eating disorders, anxiety, depression, addictions. And I think if we understood these from the perspective of a more naturally occurring phenomena, that's not to deny the fact that they come with challenges, but actually rather than tolerate and accept, I would go one further and say we should celebrate the fact that it is the universal design that we all have a unique neurology and that we have this broad variation of neurocognitive capabilities. And that was how nature designed it. And actually, while we don't tie left-handed children's arms to the chair to make them write with their right hand anymore, the metaphor still holds true a little bit in that in our educational paradigm, we're all enculturated into this belief that children with so-called learning difficulties are somehow less intelligent, less able, less employable. And that's absolutely not true. Over 30% of entrepreneurs and business owners have either ADHD or dyslexia or both. Over 40% of millionaires have dyslexia. University graduates with ADHD are twice as likely to start their own business. But if you read any of the medical sort of language, or the DSM, often it's always framed in a deficit-based way. And I think this growing awareness and significant increase in the number of people who are getting a diagnosis is not because there is this surge for everybody to be pathologized with acronyms that have the D word at the end of them. I think it's about helping people understand that if you want to be healthy and happy and lead a happy and successful life, playing to your strengths, then it's a good place to start is to know yourself. And if the information you're given is all deficit-based, then we're just disabling people even more. And thankfully, we're moving away from that deficit-based kind of shaming, stigma, sort of disorder sort of language to a much more enabling language where we are redefining our concept of intelligence and intellect, because they're two different things, in the context of the 21st century, where there is this growing number of people who are more comfortable identifying as neurodiverse or neurodivergent, depending on which term you prefer to use. And I think that's a really positive thing. It's about enabling people to understand themselves and take responsibility for their health and well-being.
I like that. I've just got to point out John Ellis, one of the great contributors ever, who's just put his autism is his superpower, but he's a bit odd. I just think that's a sensation, John. What a fantastic thing to write. Made my evening already. There we are. We're only about 10 minutes into the event. I'm going to go back to Tina. Should we, is it helpful to medicalize this? Is it, I mean, did you find it helpful when your diagnoses came through, or is it something, is because we medicalize it and we diagnose it, does that therefore sort of stigmatize it to a certain degree? I'd be interested in your perspective.
I think there's several layers. I love how Tony just put everything so concisely and articulately. And the bit is, for me, is that Tony's right, it's about language. It's language that's used to me, about me, and we're still getting it wrong. And I think that's because we're people are uncertain on what to say or how to say it. And I think even within the tribe, whatever you want to call yourselves, I think it's uncertain to a certain extent. I celebrate the fact that I'm autistic and ADHD, but I also celebrate it against everybody else I work with, because we're all different. We all require our own accommodations, or what we're better at than maybe a colleague, or what we're terrible at more so than a colleague. And for me, it's a mixture. And I suppose I'm in a lucky position that I don't require huge amounts of reasonable adjustments, but the bits I do ask for are really important, and sometimes that doesn't quite come across. It does feel, and I don't know whether this is a me thing, is that, do you not believe me? Do you? I know this is general for most people, but do you not believe me? Do you think that I could just do it just because you've asked me to, or you think I'm deliberately not able to do it that way? And so there tends to be a bit of, you're on the back foot, you're the person that needs to make the change rather than the organisation does that for you. I'm not sure whether I've answered that question or not. So.
Oh, well, I think you've contributed to it. And you know, that's what we're after, really. These are opinions as much as anything else, but it's feelings as well, you know, and we love the lived experience dimension that you bring to this.
And I suppose the other thing is, I suppose the reason that Julie came to me was, one, I'm neurodiverse, two, that I work in a neurodiverse service, and we didn't go out of our way to employ a high number of neurodiverse people. It just happened, because the bit is that the people that work with us have to be able to talk to people like human beings. Yeah. Sorry, I don't know what else to say.
No, I get it completely.
Straightforward thing, honesty, transparency, and actually we've generated bringing a whole flock of birds together, really. So and I never ever thought I'd ever say this, because actually when I was a nursing mother and baby, no, I hadn't got any children, but I understood what depression was. But now I see, being a clinician in a service, actually the importance of telling that story and sharing those stories with the people that I see. And
quite right,
I never thought I'd said that.
Quite right too. Thank you, Tony. I am going to ask you the same question, Bob. I won't always ask the two of you the same question, but in this instance, Tony, you probably heard me talk to Tina and said, is it helpful to have medicalized this, for want of a better word? Does that provoke a stigma, basically?
Unfortunately, yeah. I mean, yes, it does. But I think it's about the medical paradigm, doesn't it? And the fact that within medicine, you know, we premise diagnoses on a degree of impairment or dysfunction, but dysfunction in one context is not necessarily dysfunction in another context. And children, for example, in a school, they're being asked to demonstrate cognitive competencies every day that some of them might not have. Most people in adulthood are able to choose careers and lifestyles that play to their cognitive strengths, but children don't have that choice. And so much of our life chance trajectories are determined by what happens in our education. I think we've got to find a balance here, John, because, you know, ADHD and autism do come with challenges and impairments. And while the assessments are purely cognitive, we know that there are certain physical health vulnerabilities that correlate with ADHD and autism, such as inflammatory diseases like Crohn's, colitis, neurofibromyalgia. We know that there are higher correlations around migraine and ADHD, particularly in women. We know that women with ADHD and with combined ADHD and autism, because there's this very strong genetic overlap between the two, you know, that women are more likely to have PTSD, more likely to have PMT, rather more likely to have difficulty with perimenopause and menopause, more vulnerable to postnatal depression. We know that there are these vulnerabilities. So moving away from a medical model entirely, John, is not the answer. But, you know, many people live with lifelong conditions. Diabetes is a good example, isn't it? If you didn't know you had diabetes, then you could end up making yourself very ill and possibly even die. But when you're given the information about, well, this is the kind of nutrition you need, this is the kind of lifestyle you need, there's no reason why you can't lead a happy and healthy and successful life. And I think the same applies to autism and ADHD. But we have had centuries of language that defines people as less than, that others them, that labels them disordered. We're moving away from that now. That's a good thing. Does it fit well with medical taxonomy? At the moment, I think there's a big conversation happening, isn't there, between medical professionals and how a traditional medical model fits with a neurodiversity paradigm. I think the answer, John, lies somewhere in the middle.
Okay, thank you. Look, you were generous enough in your opening remarks, Tony, to give us some prevalence data around the different neurodiverse conditions. Mm-hmm. But it's interesting, isn't it? I mean, we've got 2 or 3 people who've already been in the chat today saying they're late diagnosed, quite recently diagnosed ADHD. And if you went back 20 years and talked about ADHD, I don't think many people would really understand quite what you were talking about. So it's interesting. Is it because we have grown better at diagnosing this that the incidence prevalence rates have increased? Or is it just the fact that this has been around since God was a lad? We're just better now at understanding it.
No, I think what the problem has been, John, is that there was this very negative stereotype that ADHD was about naughty, fidgety boys. Mm. So for people like myself and many people like me, they've been there all the time, hiding in plain sight. You can't see them because they don't have the word disability or learning difficulty on their forehead. And because we were all enculturated in school, and I'm sure everybody who's here this evening can relate to this, when you were at school, what was the perception about the children who were identified as having special educational needs? The perception was they are somehow less able, less intelligent, or that if they were ADHD, this was some kind of moral failing related to bad behavior. And why we're seeing so many adults getting a diagnosis now is we know that that's a myth, because there are lots of people with ADHD who absolutely do not align with that stereotype. And have struggled in various ways, but never got the right help or support they needed, have been perhaps medicated with antidepressant medication for years, misdiagnosed as bipolar, which happened a lot because the general psychiatry, ADHD wasn't in the general psychiatry curriculum, and psychiatrists didn't know that you could be depressed and hyperactive at the same time. So a lot of people were misdiagnosed as bipolar. I think what's happening now is, they say, this rebalancing, where people are seeing ADHD through a more balanced lens, a neurodiverse lens, if you like, and because of that, feel less ashamed or embarrassed about getting information that's going to help them manage their lives and their jobs and their health more successfully. So it is, I think, not because we're better at diagnosing, because on the NHS you can wait up to 7 years in some parts of the UK.
I'm going to come on to that in just a moment, and I'd like to speak to Tina. Sorry, keep going, Tony.
I was just going to say, I just think culturally, it is the new frontier, isn't it? Inequality and diversity. We used to label people who were gay mentally ill. We used to label people of colour in this country as educationally subnormal up until the 50s. We've moved on a great deal about understanding difference. And I think, the genetic imperative in all of us is relationship driven. We are a social species, and we like to be around people of like mind, who agree with us, who share the same values and everything else, and that's fine. However, I think what we're seeing, and this is why industry is so exciting when it comes to neurodiversity, is because we are now living in a rapidly changing technology-driven world. And as somebody said to me, the age of the nerds has arrived. It's not a phrase I would use, but what they were saying was advances in modern living, the modern workplace, our use of technology, is that tech has actually enabled a lot of us to overcome some of the difficulties associated with dyslexia, dyspraxia, ADHD. And people are thriving and being very successful in their jobs. You know, I've got colleagues who are psychiatrists who've got ADHD. I know barristers who've got ADHD. They've always been there. They just didn't identify as neurodiverse because they just couldn't identify with that enculturated stereotype. We're not better at medically diagnosing. On the contrary, it's just that the general population are much more informed now, and that's got to be a good thing. And I think for those of us who work in clinical settings, it's a bit humbling because people now are coming into appointments often quite more informed than they used to be, and that's a good thing.
All right, so I've just got some stats here. I looked them up a little earlier. This is off the NHS England website. So in December 2021, and I'm really addressing this to Tina to start with. In December 2021, there were 93,344 patients in the NHS with an open referral for suspected autism. That's an increase of 38% compared to January 2021. That says to me that our services, both in terms of diagnosing and offering support to people coming forward with neurodiverse conditions, our services cannot deal with this in a manner that any of us would find appropriate and acceptable. Is that fair, Tina?
I think on some levels it's incredibly fair, but the issue is we're almost having to catch up with the staff that are able to be trained to be able to diagnose either autism or ADHD. And what you don't want to do is water down those skills, because that diagnosis can have both a positive and negative impact. But considering we have an Autism Act that says we should all be seen within, is it 3 months? That actually we're falling way short of that. But it's, I think, not to prioritise anybody over somebody else, but it's the empowered person that's like me, if that makes sense. Somebody that can figure out actually there's something the matter, and it tends to be that group of people we're talking about here.
I'm with you.
But actually the people that need to go through the other system, which is lifelong, been had it, special reasonable adjustments for assessments to happen, will always be seen through the traditional services. So these numbers are, I think, I don't know if anybody would, please correct me if I'm wrong, is I would see this as this informed group of people who may or may not be working, who may or not be struggling at home looking after children. And please don't misunderstand that every woman has the right to be a parent and not to feel devalued for it. But actually, some women just think that's all they're able to do. And that's wrong, because that was the only route they saw for themselves.
Got you. All right, thank you, Tina. Tony, can we move this along a little bit? Because I did want to talk about capacity for the system, and I think Tina's point is well made. But look, any of us who are employers, big or small organisations, health, very large health trusts, down to very small care, domiciliary nursing home providers, and so on, we will all have people within our teams who we are responsible for, who have got neurodiverse conditions. And I'm not by any means convinced that employers have got a good enough understanding of what this means and what the implications are for them. And I wonder if you could just start to help us to understand, if I'm an employer, what can I do to better support and actually make people who are presenting with neurodiverse conditions, how do I make them feel valued and respected and recognised and supported? I'd be interested in your take on that.
Well, I mean, there is a couple of issues, isn't there, here? I think the first one is we need to have workplaces where we actually celebrate neurodiversity. Industry is recognizing that there are certain functions and roles within different businesses and different industries where certain neurotypes really thrive and excel. And if you go into any university, I've had some very interesting conversations with a lot of professors with lots and lots of letters after their name, who are realizing, a lot of them kind of, autistic, ADHD, and they're struggling. They go, well, I can't have learning difficulties because I've got 3 PhDs. Again, it's this thing about, what do you think that means? It is about cultural misconceptions. And what I don't want is for businesses to think that having, because whether they're aware of it, John, 1 in 5 of their workforce are neurodiverse, and so are 1 in 5 of their customers. Having a neurodiverse workforce is not an onerous responsibility for a business. It's an asset. If your recruitment protocols are right, you get the right people in the right roles, and you know how to performance manage and optimize workforce performance to suit the particular talents that you have. And I think, again, historically, we've gone with this idea, haven't we, that, well, if you've got a degree, therefore you're intelligent. That's not true. I think we've conflated intelligence with intellect for far too long, because they are 2 different things. And I think in any dynamic team, you do need people who see things and process information differently, because there are lots of people in the world that process information differently. So I think in a workplace, we should celebrate it. We should get our recruitment protocols right. We should get our performance management protocols right. We should have a better understanding of the strengths and potential of people, not just their challenges, and recognize that there are so many resources and pieces of technology, as well as attitudes, that are making the workplace now a place where people can thrive openly, because they've always been there. And I think the other thing is as well, and we have to think about this from the perspective of traditional concepts around positive psychology, positive psychiatry, multiple intelligence theory, Chickering's kind of development, 7 factors of development, is that, I can give you an example. My colleague of mine, who's academic genius, got 5 A's at A level, but has dyscalculia. He very nearly never got into university because he was struggling to get his maths at GCSE level, or O level as it was then. And the teacher's response was, well, you're being lazy, you're not trying hard enough because you're achieving in every other area of the curriculum. Why aren't you achieving in maths? Intelligence is not that, it's not that sort of monochromic, it's intelligence is really diverse, and having a degree does not mean you're great at everything or that you're really intelligent. Context really matters. Everybody's neurology is unique, but so are their interests and their talents and their abilities. And yes, some people call them superpowers. And I know a lot of children do. And you know what? I'm not going to take that away from them, because that's one way. I've heard young people saying to us, well, don't call me special educational needs, because I certainly don't feel special. And I certainly don't feel like I'm treated special. But I think in the workplace, there is this great, wonderful, positive change around how do we enable people to thrive in the workplace and be successful and add value to any organization. And underpinning all of that, John, and this is important for anybody who works in the public sector, there is a covenant here between the health service, the education service that we pay for with our taxes, and industry, who pay corporation tax, is that the workforce needs a well-educated workforce for the 21st century. So is our curriculum as relevant as it needs to be for the 2020s and 2030s in a rapidly changing workplace? And is our health service making sure that we have a healthy workforce? Because culturally, and I say this as somebody who's a clinician, within our health service, there are significant health inequalities, both in terms of access and treatment for people with ADHD and autism. And that's something that really needs to be addressed, because the bottom line is, if health doesn't do their job well, that impacts on costs to education as well as the lives of children who can't access an assessment and diagnosis. If health doesn't do their job well, then it also impacts on people's livelihoods, economic independence. It impacts on the workforce if there isn't a healthy workforce. And we've seen what the pandemic did to people's physical and mental health. We can't just continue to have public services in silos with our own KPIs and not factor in how what we do or don't do impacts on other areas of public service and the general public who pay for public services with their taxes. The move towards integrated service design, delivery and commissioning is a welcome and long overdue move, because I think for too long we've all worked in silos, and that needs to change.
Thank you, Tony. Tina, I'd be really, and you are welcome to use some of your lived experience in this regard. One of the, I'm going to call it a challenge, and that may not be the right language, but bear with me here. One of the challenges for people who are responsible for looking after others in a leadership role is that when somebody comes to you and explains that they're now diagnosed with ADHD, for example, or they've realized actually, and now they've actually been diagnosed and they do have dyspraxia, dyslexia, autism, whatever else it might be. Is there anything practical that we can do to make their lives easier within the workplace? I mean, and is it just a matter of listening to them, or are there some specific things that we can do that actually that would tick a lot of boxes and help them significantly?
I think there are, again, on these layers, is that it's listen, hear, and actually respond to what's being. Obviously, you can't put something so expensive in there that, we've all got to be realistic. But it's establishing. But what you'll find is that you may not know what you need, because some of the things you don't appreciate, you're not doing in a way, or that are actually part of being neurodiverse. So, and what was I going to say is that it's also making use of other, because within Birmingham and Solihull we have a diverse and disability and neurodiverse group that supports staff particularly. So it's making sure that there is access to peers that can share some of those experiences, what works, what doesn't work within the organisation. So it's not quite the same as knowing another autistic person outside. The thing I would really, really, really like to maybe pass across is, right, if you've got autism and ADHD and all of a sudden somebody gives you a tablet that improves your ADHD and you're putting in all that effort to try and get better at organising, etc. But actually, just because I have a tablet or you put some reasonable adjustments in place doesn't make me the same as a neurotypical person, right? And that's what's sometimes forgotten. And actually, in some of the ways you try, particularly around behaviour things, is that you try to get, even though you think you don't, your neurodiverse person to behave like an atypical. So, and I suppose it's learning those differences of what's really. So, well, nobody should be rude to anybody else. I'm not saying that. It's just we will never meet that standard if that's your standard.
Yeah. And I love that. I think that's a really objective and intelligent way of putting it, actually, Tina. And thank you. I like that of celebrating the difference rather than trying to make people conform to an atypical norm, for want of a better word. Tony, would you like to add to Tina's comments at all?
I think, again, it's just about recognizing and celebrating difference, because difference is the norm. You can still be one of us because we have a common humanity. The gene variants involved in ADHD and autism are, a number in the region of about 70, apparently, when, we have billions of pairs of base genes. And I think that, it's like that, again, that analogy of tying a left-handed child's hand to the chair to make them right with their right hand. Why does everybody have to be the same? Why do we not celebrate difference. And I think, again, it's beginning to happen. Look at how attitudes towards race have changed. Look at how attitudes towards LGBTQ community have changed. It is a new frontier in equality, but I think it's also, dare I say, a step forward in our evolutionary understanding of what it is to be a human being, and recognize that not everybody fits into the same box, and that when people experience and see the world and process information from their environments in a different way, it doesn't make anybody wrong or right. It's just about understanding that this lens of neurodiversity is kaleidoscopic, and that was the way it was always meant to be. So what is it about human beings that have feared difference? You're not one of us. In order to be one of us, you have got to be XYZ. I think we're evolving away from that, and have been for quite some time. And I think, as I said before, I think with neurodiversity, why do people have to be a certain way? Why do we not just accept and celebrate and accommodate? Because accommodate, again, is not an onerous responsibility. It is about enabling and optimizing, as opposed to disabling people because they're not like us.
Yeah.
Can I just say,
yeah, go ahead,
John. I just suddenly realised that there were a couple of things I hadn't said. Is that reasonable adjustment? Yes, you can go to Access to Work. It's just this in response to Access to Work. Yes, they do put things in place and suggestions, but their knowledge should be up to date of what's available. So the computer programs right through to pens that read to you. So, but Access to Work is proportional funding. So if you have worked for your organisation for longer, you get a smaller amount of that. But if you've recently joined somewhere, you get a larger proportion from the government. And a lot of reasonable adjustments you can make are actually free. So things like moving desks around offices, so your backs aren't against the door, or that the window's open, or that every hour that the person gets up and goes outside. And they're things that can improve a lot of people's lives. But what you often have, and I don't know what other people mix with, is envy of your adjustments.
Yeah,
so if you're,
I remember the smokers, long ago, you'd be envious about them clearing off every hour for 10 minutes to have a cigarette break. Yeah.
And the bit is it, so it's wearing headphones because it's a noisy office, or you can listen to music and that keeps you on point, or watch things, which I know sounds really bizarre, but it's stuff that keeps you productive because something's entertaining that bit that's being a bit mischievous, and you are concentrating on what you're meant to be doing. And so where actually other people begrudge on some, and then it sort of stops here. So. And we need to also think about service users that meet this as well. So it isn't just about. I was going to
come on to that in a minute or two.
Okay.
We've got about 20 minutes to go. If you've got questions, by the way, do pop them in the chat, and we'll see if we can leave 10 minutes or so at the end for some questions for Tony and Tina. Don't be embarrassed about coming forward in that regard. So what I'd like to do now is just consider this. How do we encourage organizations to concentrate on outcomes? In other words, what people generate in terms of value and objective fulfillment and so on. How do we help organizations to concentrate on that, rather than, I've watched and been involved in all sorts of appraisals in my time where you constantly having idiosyncratic behaviors pointed out to you and you're asked to adjust them, change them, instead of, can we just concentrate on what I produce and what value I create, rather than worrying about whether I conform to your stereotypical behaviors of what perfect in the workplace looks like? And I'd love either of you to comment in that regard.
I think we've got to be careful as well here, haven't we? Because as Megan rightly pointed out on the chat at the very start here, you've met one person who's autistic, you met one person who's autistic, and the same applies to ADHD.
I like that. No, that was great.
We are all unique characters, and we are the product not just of our genes, but of that complex interaction between genes and our environment. As a species, we've been very good at adapting our environment to suit our neurology and our competencies. And over many, many millennia, from an evolutionary perspective, we have epigenetically adapted our neurology for our environment. I think what's happened is that the world has changed so much quicker than we have been able to adapt. And we are being much more creative around being able to adapt our environment, including the working environment, how we use technology, etc. But at the end of it all, we're still individual human beings who are more than the product of our genetic expression or our epigenetics. And, your enjoyment and your thriving in the workplace is also impacted very significantly by the relationships that you have in that environment, and that fundamental need that all human beings have to be known and understood, and to feel that they belong and that they're valued and they're making a meaningful contribution. And I think that has got to be the primary driver, not in what way are you different. If we're asking the question, in what way are you different, it should only be from the perspective of how do we enable you to be the best that you can be and contribute, in an optimum way.
Yeah, and it's interesting, I must have done countless interviews during my career, because I'm of that kind of age where I can look back, far too long, really, and sort of plot where I've gone wrong here and there. But, we've not been good, and I know I don't think a lot of managers and supervisors are good at interviewing and identifying people's strengths and skills in an intelligent manner, and then think to themselves, how can I make that work in my organization, irrespective of other bits and bobs that actually is not perfect, but you know what, I should just discount that because it's the strengths that I need to focus on. And we're poor at that, And
I think it's thinking, how else can you do an interview? Because that bit, sitting there for half an hour, 45 minutes, an hour, is actually, I don't know, if I just describe what I'm doing now, actually, I know loads about what I know loads about, but actually put me in this spot here, I feel as if my words are bumbling and all this sort of stuff. So why not do interviews over a day, which is what we do? So we have like an event sort of in the morning of getting people to think about things, and then we interview them in the afternoon. But these are people that have been part of that morning bit. And actually, I wouldn't, I don't know what the statistics are, but we're keeping the staff that we employ, and people aren't going elsewhere. And that's not because, well, maybe I don't work them hard enough, that's what it is. But the bit is that it's really important, and it's easy for me to come in and do that because I feel quite comfortable doing that. And being part of that and being entertaining. And actually, I would say that was probably, I pinched it from somewhere else. It was probably one of the best interviews I had previously, probably about 20 years ago. But I did, can I just give you a little vignette about somebody?
Do, please. We'd love you to.
I obviously work clinically, and I saw a lady yesterday. She doesn't work in health. She works in a university setting. Second time I've met her about a month ago. In this month, all that's happening to her at work is she's being more and more demoralised. She's being seen as obstructive, annoying, putting things in the way to disrupt everybody else. She doesn't quite fit the culture of where she's working. And I think, even though I think this is quite a common thing across organisations, because through being innocent, you can't use that word, but being naive and not being thoughtful can get a very similar presentation to the woman I saw yesterday. And the bet is that employers need to do better. And from that perspective, I mean, she's, yeah, so she's, you know, I'd have her working for us, you know what I mean? And you just think, well, actually, you've knocked everything out of her, and you're just, yes, I know.
You've hollowed her out, and now it's her fault. Yeah,
exactly. And that's the other bit, is that by doing some of it, all of a sudden you're the one to blame, because you have a voice and you will use it. You, part of those lovely qualities of being autistic is that you point out things that are wrong, and you'll do it often. And if nobody listens to you, you'll keep saying it. And those sorts of things are really helpful, but you're only doing it 27 times because they didn't listen the first 26. And, you know, it's those sorts of things. And the bit is that she isn't doing it to be annoying. She's doing it because it would help.
Yeah, exactly. So perfectly put. I do like that. I'm grateful for your vignettes, Tina. I think you've illuminated this evening's little power hour rather fantastically. We've got a few comments in the chat and so on. Just before we move to a Q&A, you've got some people sympathizing as it's horrible, and unfortunately I've seen a lot of this with clients, patients in mental health service. What else have we got here? Anna's had obviously had a difficult time of stuff. I love David Scott's comment. He says organizations which concentrate only on financial contributions are unlikely to be neurodiverse friendly. Triple bottom line seems desperately unfashionable these days. Some of us are still determined to make it work. Well, hallelujah to that, David. I rather concur there. Just in case some of you are wondering, the IHSCM, we hope, is a neurodiverse employer, and we certainly don't only focus on the financial bottom line. Don't know whether that's reassuring to you or not, who pay your membership fees, but there we are, it's a fact. All right, look, we've got about 10 minutes to go. Would anybody like to unmute? I think you'll agree, two sensational guests this evening who've really illuminated this important topic, I think. Tina, you may well have been terrified of what was likely to take place, but I think you've done yourself really proud. I've loved the way that you've conducted yourself. Would anybody like to ask?
Being put on the spot.
Yeah, well,
and then immediately your head empties.
You have coped wonderfully well with it. So would anybody like to unmute? Do just raise your virtual hand if possible, or pop it in the chat if you'd prefer me to read it out, and we'll do that. Let's have a few questions for our guests, Tony and Tina. Who'd like to?
Morgan, yeah.
Please don't leave us hanging, you know.
Apologies,
go ahead, Morgan.
I was a little bit late, as I often am. That would be the ADHD.
Great to have you. It's great to have you along.
But yeah, so I was there fiddling to it, so I missed the very beginning bit. So I'm really sorry, but Dr. Lloyd and Tina, what are your job roles?
Tina, do you want to go first?
Oh, okay then. So I'm a nurse by background, and I've had lots of clinical experience, particularly within mental health. The only thing I haven't done is manage a CMHT, but I've worked everywhere from prisons and forensic care to community, and I work in a neurodiverse team in Birmingham for the assessment of ADHD, and my sort of specialism is around women, ADHD and autism, and women without I also am qualified as an art psychotherapist as well, which was a side thing, because that's where I started in the world when I was a lot younger. But I try to be very practical, very sensible as best I can in helping people make change.
In summary, Morgan, Tina is ADHD clinical lead for Birmingham and Solihull.
Oh yeah, I forgot my job title.
Well, obviously, because that's what happens. But no, it was really helpful. Thank you so much.
And Tony, would you like to go ahead?
Yeah, I'm the chief executive of the ADHD Foundation Neurodiversity charity. Have ADHD myself, still medicate for ADHD at 60 years of age. I think nearly 80% of the sort of staff team are ND, a lot of them ADHD, some autistic, many dyslexic, dyspraxic, all of whom are postgraduate qualified, very successful, very good at what they do. I wouldn't say that being a CEO was ever on the bucket list of things I wanted to do, Morgan. But I think, again, sometimes, you find yourself in situations where if you feel passionate about something and you want to do something, then, you either complain and moan or you step up and do something about it. And I think for us as an organisation, the bottom line is not our turnover. Our success indicators are social change and social impact. But for any NGO, you need to have integrity of purpose. And I think sometimes having integrity of purpose means that you don't necessarily become solely a subcontractor for statutory services, that you have to remain independent. You have to be able to challenge the status quo and the popular convention, because I think sometimes the risk is you end up playing the piper's tune. And I think for many NGOs, it is, you are an organisation there for public good. And I think you have to walk the talk. And it is something that we try to do here. And clearly for I used to use the term, I felt like a condom salesman in the Vatican when I started with this. Nobody wanted to talk to me. Nobody was interested in what we had to say. And in 15 years now, to have seen this transformation of attitude, I do feel incredibly privileged to have been a part of it. There are a lot of very, very dynamic, pioneering people who've been voices, for many years, and I think it's wonderful that they're being heard. But I think, irrespective of your job, and I also work in a kind of multidisciplinary setting like Tina, you don't see the differences. You see human beings, and everything else then just fits into place if it's person-centered. And the other thing is as well about profitability. I think when you get the best out of people, any organization is successful. And if your KPI is making a profit or your KPI is providing a service, it actually makes no difference. What the point of a successful organization is that everybody is thriving and adding value, and that the sum is greater than the parts.
There you go, Morgan. You asked, and we've had two very full answers there.
And I see my role in the trust that I work in to advocate for the guys, and I mean guys, men and women, on their behalf for services, but also for better experiences within our CMHTs and the better understanding, better knowledge for our peers, and whether they want to give that to me or not, I do it. So
all right, I'm just going to cut across here. So Prim has asked a question in the chat. They say, we know that there are many reasons why we don't have a definite answer for how many people are neurodiverse in our population. Professor Kirby regularly refers to this. We have this 15 to 20% figure, the 1 in 5 people are neurodiverse, which is shared widely. So is the 15 to 20% figure correct, or is it at least 15 to 20% of the population? It could be more. Tony?
It's very conservative. 1 in 10 people have dyslexia, for example. But in our schools, even now, only 2 out of every 10 children with dyslexia ever get assessed. And the other 8 underachieve and leave school thinking they're stupid when they're not, and underachieve and are more likely to be dependent on the state and public services because they didn't thrive in education because we didn't see their dyslexia. So we're only diagnosing, if 1 in 10 people have dyslexia, I don't even know that diagnosis is the right word in this context, but we are only assessing and identifying and supporting 2 out of every 10. But, your average school of 500 kids then has 50 students with dyslexia, and we're only picking up a very, very small fraction of them. Similarly with dyspraxia, ADHD, autism. So I think the 20% number is conservative, but I also think, and I know a lot of people don't like the word spectrum. It is a spectrum of human neurocognitive capability. And you know, people say, well, I get annoyed when some people say we're all a bit dyslexic or we're all a little bit ADHD. Well, the reality is we are. It's the same genes that we all have, but the expression of those genes in some people is slightly different or more pronounced. And I think the number is a very conservative number. And I think the standard distribution curve, while helpful from a researcher's perspective, or perhaps even from a clinical perspective, is not necessarily entirely helpful when we're talking about human potential.
All right, I'm going to cut you off there because we've got another questions come in. I'm not sure who this is, JM, but it's good for you to put it in the chat. Mears-Erland syndrome is a neurodiverse condition that is rarely talked about. Many health professionals don't know what it is. Should we provide more training for our health and care professionals around more neurodiverse conditions so they know how to support their colleagues and teams? Tina, what do you think?
Totally, and it's part of what I do around our organisation. I am commissioned to do that. All the other bits I just added for free. But I suppose I was going to say is that it's increasing our own knowledge and because there is the wonderful world of social media is around. There's a real thirst for by giving away knowledge around your developmental conditions, and that actually it's really well, I find it very enlightening reading other people's things because you think, oh, I didn't realise that, or you know, and we're all different, so we're going to interpret things differently. But for me, it is about knowledge. Sometimes that's about seeking it yourself, and totally agree that we should think wider. In my world, that I know what that is. Do you know what I mean? And
Perfect.
so it's not in others.
That's perfectly put. I've got one final question, but otherwise we're going to be out of time. I'm going to ask each of you this. Tony, if you could keep your answer short, and Tina, keep your answer short. Robert says if he could do one thing, or more accurately, first thing, to help a colleague newly diagnosed with a neurodiverse condition, what would you suggest? Let's start with Tony. God, that's a difficult question.
Tell me what you're great at, and tell me what you really thrive at, and tell me what you enjoy and what you'd like to do more of and better.
Perfect. Tina?
Very similar, but also a bit like the other answer, is learn information, learn about yourself in that context, because the bit is that you've been so used to going, sorry, oh, it's me, that actually it's just the way that you may be interpreting things. So the more you know about a neurodevelopmental condition and the context of you, I think is incredibly important.
I think the final word, John, has got to be go and celebrate neurodiversity. Celebrate it. You know, the umbrella term, the umbrella project, you know, we should be celebrating this. This is a very liberating and enabling thing.
I love that. I love that. I have to say we were quite privileged fairly recently or during lockdown to have an organisation called Electric Umbrella come and do a whole load of
yeah.
And they were a sensation. So a big shout out to them. Yeah. If any of them are on the call this evening, we have the utmost respect for you. Look, that's been great, hasn't it? I'm hugely grateful to Tony and Tina. I think they've been some of our best ever PowerHour guests, to be quite honest. You've been so open. You've been so generous with your views and your opinions. You haven't held back. I think that's really cool. Big thanks as well to SFI Health, who've supported this event. If you'd like to know more about SFI Health and what they do please Google them, search them out. They're a grand group of people, and they've got some interesting supplements and so on that can help. Beyond that, it's my only official duty now, bang on 6 o'clock. Look at that. This is a PowerHour after all, to wish you all a very good evening. I feel really uplifted and inspired from what I've heard today, and I'm very grateful to Tina and Tony for their contributions to that, and to all of you who've watched and contributed as well. Thank you very much indeed. All right, that's it. We're away. Thanks a million, everybody.
Bye.
Good night, everybody.
Thank you.